You probably never realized it before, but when you take a sip of your tap water, you are actually preventing tooth decay. But that might now change. Health Secretary Robert F. Kennedy Jr. is urging the CDC to stop recommending fluoride in public drinking water. Kennedy says he's assembling a task force now of health experts to study the impacts of adding fluoride to water and to make new recommendations. As Secretary Kennedy can't outright order communities to stop adding fluoride to water. However, he can direct the Centers for Disease Control and Prevention to stop recommending it and work with the EPA to change the allowed amount. Joining us now is our ABC News medical correspondent, Dr. Darien Sutton. So, all right, Doc, as we all grew up learning, fluoride strengthens our teeth. It reduces cavities. So, of course, it's in the water sources across the U.S. You know, what do you see happening if communities listen to RFK Jr. and his recommendation to take the fluoride out?
No, Kira, I listened to the experts, and some pretty premier institutions have already voiced their opinion about this. For example, the American Dental Association is saying that studies have cited that fluoride in community water systems have prevented at least 25% of tooth decay among children. It's important to note that that is the #1 chronic disease among children, and as you can imagine, if untreated, leads to chronic disease in adulthood. In fact, the American Association of Pediatrics has also stated that fluoride in drinking water, for what we know right now, is safe and effective for children and important to preventing tooth decay. So just to step back and help understand through all of this noise, fluoride, as you stated, a natural mineral in the earth, when added to water, strengthens enamel, reduces the risk of tooth decay. And I think a lot of this confusion is coming as RFK Jr. is citing studies that have reported that high levels of fluoride are associated with things like developmental delay and lower IQ. And that is incredibly concerning, but context is so important. These studies were done outside of the United States in communities that had extremely high levels of fluoride, twice the recommended level that is here in the United States. So it's so important to understand where this information is coming from.
So RFK Jr. also claims that fluoride is a dangerous neurotoxin that is associated with arthritis, bone breaks, thyroid disease. Do studies agree with him on those things?
Depending on how you look at these studies. And so when they've asked this question, and there was a relatively recent study that looked at least 26 different studies. It was a systematic review in looking at the association of recommended levels of fluoride that we have here in the United States and outcomes such as cancer. And there has been no known association. However, fluoride is, as an example, one of those substances that can be helpful at one dose and harmful at another. And in emergency medicine, that's why we always say the statement, the poison is in the dose, or the toxin is in the dose. It's very possible for something to be helpful and to benefit you in terms of your overall health at a lower dose and also be harmful at a higher dose. The important part here is that we have recommendations in place within the United States not only to benefit dental health, but also prevent those risks. And that is what's key here. And ultimately, these recommendations will recommend for state and local communities, but the final decision does come down to state, local communities, and the citizens within those communities.
Dr. Darien Sutton, thank you.